Hey everyone, hope you're doing well. Happy Friday. I'm really happy that it's Friday and that I get the weekend tomorrow to relax my brain and get ready for new patients on Monday. But I wanted to jump on here and talk about PCOS supplements for fertility. Thank you for joining the poll this week to figure out what I should talk about, because sometimes I, run out of ideas. So I'm really glad that you guys posted what you wanted to chat about. And so today I'm going to talk about from what I think are the three most important supplements for PCOS and fertility. Now, I actually have a video on this and I go over more supplements. So I'm going to post the video below. It's on my YouTube channel, and we're talking about a few additional supplements for fertility on that video. But today what I'm going to do, I'm going to tell you my top three and give you a little bit of research behind those, and then you can view the video afterwards and learn a little bit more. Also, in January, I'm going to be doing a full talk on PCOS and fertility so that you can learn everything you really need to know about PCOS and fertility. I'm going to go over conventional treatment methods. I'm going to go over naturopathic medicine, the research. I'm going to go over diet, more detail in terms of supplements. So stay tuned for that. It will be in January. I haven't decided the day yet, but once I do, I will definitely post it and let you guys know. All right, so top three supplements for PCOS and fertility. Number one supplement, and it goes without saying, getting a good prenatal is really important, but there's a few things that you need to look for when you're looking for a prenatal. First things first, the vitamins need to be in their absorbable form. So oftentimes vitamins in prenatals, from what I've seen, that are over the counter, the vitamins aren't in their absorbable forms. So usually what we see is forms that are in their citrate forms are actually better absorbed. So for example, zinc citrate can be much better, magnesium citrate. All of these are readily absorbed by the digestive system. And also looking for the activated form of B vitamins. So if you just search like names of activated forms of B vitamins, you'll be able to see all the activated forms. Especially B12. B12 usually comes in cyanocobalamin and a lot of over-the-counter prenatals, but looking for a prenatal that has either methylcobalamin or hydroxycobalamin would be a better bet. The other one is really important, is folate. So folic acid is extremely important when it comes to fertility, but basically when we're looking for a prenatal, we want to be looking for a prenatal that has folate. This is methyl tetrahydrofolate. This is the activated form of folic acid, and the reason why we're looking for that is because about 30% of the population has a genetic defect where they cannot convert folic acid to folate. So, that conversion issue can impact fertility outcomes. So you really want to make sure that you are using a prenatal that has the activated form of folic acid. Here in Canada, we usually use 1,000 micrograms or 1 milligram of folate in prenatals to make sure we're getting enough. And in other countries, actually recommend dose could be higher or even lower from what I've seen. So prenatal, super important. Make sure the vitamins are in their activated form. Make sure that the therapeutic dose is big enough. So that one might be tricky for you to figure out on your own. So working with a healthcare provider, they can find you a prenatal that actually really helps in terms of finding the exact dose in terms of some of the supplements. Oftentimes I find, because they're packing in a lot of nutrients and vitamins into prenatals, the dosing of a lot of the supplements or vitamins become really low. So finding a prenatal that has a good amount of B vitamins, good amount of magnesium, especially iron, this can be really, really important. The other thing is making sure that the prenatal doesn't have too many fillers or preservatives, because then now the liver has to work a little bit harder to process all of those ingredients. And then also, sometimes what I'll see is prenatals will come with omega-3s inside the prenatal. It's virtually impossible, in my opinion, to get fish oil into prenatal along with all the vitamins you need, and have it to be really good quality, especially because with omega-3 fatty acids, the dosing has to be quite high, especially in fertility. And so if the prenatal is coming with omega-3 fatty acids plus every single thing you need, and you only have to take one a day, it's probably not the best prenatal, probably not enough of the nutrients there to really support fertility outcomes. The other thing to note is that it takes 3 months for an egg to mature. So if you're thinking of trying, for example, in the new year, give yourself at least 3 months of taking a good quality prenatal and getting yourself on a good preconception plan, so that when you do end up trying, the eggs that are ovulating out, these are the eggs that we've worked on in the last 3 months to really get the quality up. So again, it takes 3 months for an egg to mature. So whatever we're doing to the eggs today are going to be the eggs that are going to ovulate out in 3 months. So we really want to make sure everything we're doing in the next 3 months is pristine. We're eating well, we're taking good quality prenatal, we're working on maybe insulin resistance if we have that, and we're bringing, hormones into balance, so that when we do go and ovulate in the next 3 months, things look pretty good in terms of fertility outcomes. Okay, so prenatal is the first one. The second one, which I know you guys have probably heard of, is Myoinositol. Really, really famous, and probably one of the most researched nutraceuticals that we have for PCOS. And so the benefit of Myoinositol, so many benefits. First of all, I actually just did a video on this and posted it this week on YouTube on the top 5 most important benefits of Myoinositol and PCOS. And so go watch that video again. I will also post the link below. But when it comes to fertility outcomes, we use Myoinositol for many reasons. Number one is insulin resistance. We want to bring insulin levels down so that glucose can get inside the cell, and so our cells are actually getting the energy it needs. The more insulin we keep outside the cell in the bloodstream, the more testosterone we're going to make, and the more issues we're going to have with late ovulation. So Myoinositol can be really, really great to help with insulin resistance, bringing the insulin down so that testosterone can also be at bay, and so that we can make a good quality follicle that houses the egg that will ovulate. And so the other thing that Myoinositol does is it actually helps with egg quality, which is incredibly important when it comes to PCOS and fertility outcomes. And so what we want to do is we do want to be taking, if there's a cyst on the ovaries or multiple follicles on the ovaries, we do want to be taking a 40-to-1 myoinositol to D-chiroinositol. So these are 2 different types of inositols. Basically what that means is the chemical structure of the inositol is just slightly changed, and that's what we're looking at. We're using the specific inositols that we see in the ovaries. And there is a few studies showing that using the 40-to-1 ratio actually has better clinical outcomes for those patients who are going through IVF procedures. So it's actually really important for fertility, especially if you have those multiple follicles around the periphery of the ovary, or if you have cysts present. So definitely working on insulin resistance is really important. The more insulin we create, the more testosterone we might create in the ovaries, and that can impact our hormones in terms of creating that nice quality follicle that will house the egg that will ovulate out during the month. What else does Myoinositol do? Myoinositol is really great at curbing carb cravings and sugar cravings, and can be really helpful in that sense because it's working on insulin. So The other thing that we could take into consideration is the fact that myoinositol not only helps with egg quality, it helps with insulin resistance, it helps reduce testosterone, and support healthy ovulation in women with PCOS. And so getting a good quality inositol can be really helpful here. Even if you don't have insulin resistance, because it helps with egg quality. And the other thing to note is that it can actually be taken during pregnancy to help prevent gestational diabetes. So considering that as well can be really important, especially if you have a family history of diabetes or you've had gestational diabetes in previous pregnancies, or if you have insulin resistance. So that's myoinositol. And then last but not least, I know the first one sounds a little bit like, of course we need a prenatal, but it's extremely important to be getting the right prenatal. And the last one I'm going to talk about also seems not so like revolutionary, but I'm going to tell you a little bit about it, and I hope you can learn a little bit more about vitamin D. Vitamin D is incredibly important. It's like one of those vitamins that we know we all need to take, but a lot of us aren't taking the actual dose that our body needs. From what I've seen, most people are recommended 1,000 international units, but this is typically not enough for a PCOS woman. We know that or even in general, honestly, because especially here in Canada, depending on where you live, actually maybe you get enough vitamin D, but here in Canada, we're definitely not getting enough vitamin D or exposure to the sun, especially in the winter time, because we're all bundled up. We have hats on, we have mitts on, our whole body is covered, so we're definitely not getting any sun exposure. And so it's incredibly important to be taking some kind of vitamin D, but before you take the vitamin D, you want to get your blood levels tested. So the first things first, get your blood tested, figure out how much vitamin D you actually need, and then the dosing can be appropriate for that. And then also retesting in 3 months to make sure you're actually absorbing the vitamin D. The other thing about vitamin D that's really important is that we have vitamin D receptors on our entire reproductive system. So it's actually really, really important when you're trying to conceive to make sure you're actually getting enough vitamin D in your body to help support your hormones. Again, getting tested and then, taking the appropriate dose. Typically, I want to see vitamin D greater than 100 nanomoles per liter. This is the units we use here in Canada. So you can check your vitamin D units as well in your country and see what that kind of converts to. So the other thing about vitamin D is it helps with mood, which is really important, especially when it comes to fertility, because sometimes, fertility can cause anxiety and depression. So we do want to be taking, some kind of vitamin D, especially if there's a deficiency and we have some anxiety or depression as well. So those are the 3 supplements that I would really consider when it comes to PCOS and supplements. We don't need to make it too complicated. The basics are really important. A good quality prenatal, some myoinositol, and then also making sure you get vitamin D. And also the video that I go over in my YouTube channel talks a little bit more about some additional supplements, so take a look at that so that you can really understand a little bit about supplements and PCOS in terms of the research. And in January, remember, I'm going to be doing a talk on fertility and PCOS. It's going to be a webinar open to everybody, so I hope you can join and learn a little bit more in terms of PCOS and fertility supplements. Hope you guys all have a great Friday, and I'll see you next week.